I'm Dr. Kuperan. I'm a nose and sinus specialist and board certified in ear, nose, and throat surgery. The question coming in from a patient is, I'm hooked on Afrin and I feel like I can't breathe without it. What can I do? This is something that I see day in and day out in my clinic. It's so common. What Afrin does is it shrinks the tissues inside your nose, particularly the turbinates. And in the beginning, it works really, really great because it really opens up the nose. But after about 3 days, you get a rebound effect. And then you're just using the Afrin just to keep the nose open. What are the pros and cons of using a medication like Afrin, which is a nasal spray? So the cons of using Afrin are, number one, it can become addictive if used for long periods of time, typically more than 3 days. And the other major con is that it's really not a great long-term solution to your breathing problem. The pro of Afrin is that for really acute episodes, if you've got a cold or just a little bit of a stuffy, congested nose, it can really help you get through that initial phase so that you can feel like you can breathe at night. And that's typically why people use it, is just to get some reasonable sleep at night because their nose is so stuffy. So I think for short periods of time, it's totally fine. The other pro of Afrin is in unique situations where if you've got a nosebleed, the Afrin can really help to control a nosebleed because it's a decongestant and it just contracts and shrinks those blood vessels that have opened up, and that's why your nose is producing blood. But the long-term effects of Afrin are really negative. You can get severe rebound nasal congestion in the nose, which really can make it hard to breathe. I see patients all the time who are basically hooked on Afrin, and without using it, they can't breathe at all. That's why I don't like Afrin for long-term use. The breatheplasty, which I trademarked and patented to take care of that breathing problem, provides a really elegant long-term solution to breathing better, because what it does is it surgically reduces the turbinate, which is the same thing that the Afrin does, without this rebound back and forth effect that you get with the medication.